Joining us today, Dr. John Grant, neurosurgeon with Neurological Surgery PC with special training in pediatric neurosurgery. Dr. Grant, welcome. Good to see you.
Thank you.
And we're talking specifically about concussions and, in an overall sense, head trauma today. I guess it's fair to say the best treatment for head trauma or concussions is to avoid it, to prevent it completely.
That's very true, that there is no treatment for head injury that approaches avoidance as a means of getting rid of the problem. But I think inherent in most sports and inherent in life itself is the possibility that the head will be injured. I think it's important not to underestimate the effects of that.
I think many of us are aware that the initial injury is one thing, but the preponderance of re-injury, that it's very, very common that once the head is injured in any form, that if you get back onto that field of play too quickly, re-injury can happen quite easily.
It's certainly true that repeated injury to the brain, even if it seems to be subclinical, in other words, it's not causing a problem at the time, can over time cause very serious problems. In the short term, any head injury that causes symptoms needs to be taken very seriously indeed, and it's probably, if you have a serious concussion, to be out of the game for 6 weeks, I think, is probably the only reasonable thing to do, or at least 6 weeks, or till the symptoms go away. And it's very important, I think, to remember, having been a teenage boy myself once, that a teenage boy is not likely to tell you that they have a headache if it means they can't suit up. So I think what parents and people in positions of authority need to be very cognizant of that fact, that they need to err on the side of keeping kids off the field, particularly if they have symptomatic injuries. Is it possible to, say, play football or indeed, say, box, for instance, and not have blows to the head? It's probably not possible, but one needs to minimize those as much as possible.
What about treatment? We said at the top that to avoid head injury completely is the best way to go, but should it happen, what do you face in terms of options?
So we see these children either sometimes as severe head injuries, which is a very different sort of a setting where we see them in the hospital, and certainly the philosophy that we would have is that early aggressive treatment of severe head injury is very important. But thankfully we don't see very many of those sports related. We see an awful lot of children that come to the office after a relatively mild head injury. And this is a rather unpredictable effect of head injury, that even with relatively mild head injury, sometimes you can get what we call this loss of autoregulation. In other words, the brain is no longer able to control its own blood flow. That happens in an unpredictable way for an unpredictable length of time after even sometimes a relatively mild head injury. So you have a child who comes in who perhaps was, in the case of one particular very brilliant and very talented soccer player that I knew, she'd been standing on the sidelines and the ball just hit her head. And for about 2 years afterwards, she had a loss of general appetite for life and bad headaches whenever she exercised. And what happens when you exercise is that the muscles, the blood vessels in the muscles open up, your blood pressure in fact drops, the muscles take all the blood, and normally speaking your brain's able to override that and send blood back up to the brain. But because of the head injury, as I say, in an unpredictable way, that ability can be lost for some time. Interesting, that post-concussion type syndrome can be treated with tricyclic antidepressants, but in fact time is the best healer for that.
Surgical intervention. Is surgery still the last option when you look at the spectrum of approach?
Again, for the very severe head injuries, I would actually say no. Coming from Ireland, where the tradition would be that one is a very aggressive medically and less aggressive surgically, I would still maintain that after 25 years of doing this, that surgery is the least noxious thing that we can do for you for severe head trauma. And my approach towards head trauma has developed to the extent that if you have increased intracranial pressure, we talked earlier about the ability to auto-regulate. After a severe head trauma, there's no question that the ability to auto-regulate is gone, and therefore your intracranial pressure becomes very important because your heart has to push against that. So we can't let the intracranial pressure get too high, and consequently we operate very early and take off almost all of the skull and put it in the belly to allow the pressure never to rise to critical heights. We used to medically treat people for that. We put a tube in and breathe for them. We would give them things to dry out their blood. But in fact, neurosurgery is coming around to the fact that surgery is probably, and early and aggressive surgery is probably the best way to treat these kids.
And fair to say that, as with so many other fields, in medicine, that more is being learned every single day about this?
Well, yes. I mean, so this is not a new approach. I mean, there's nothing new under the sun. But I think what's different now is that anesthesia is so much better, and intensive care unit care is so much better, that we're able to do the things now that a generation before tried to do and failed, not because of any inherent problem with the procedure itself, but with the ancillary care.
Dr. John Grant, so much food for thought and so much information, and we appreciate it. There's a lot to learn about this, and this was a learning experience in hearing from you. We thank you so much for joining us today.
Thank you very much. My pleasure.